Hey there, we are back today to talk to you about OCD. Now, a lot of people say, oh, I'm OCD about this, I'm OCD about that. But doctor, what exactly does that mean?
What these people mean probably is the passion, that they are passionate about something. But in true sense, OCD is the obsessive compulsive disorder. So obsession is any idea or any thought which is repetitive, intrusive. Even if the person tries to control it, he is not able to resist or control. So to control it or to get rid of it, what that person does is the compulsion. For example, I had a patient who had the obsession of hand contamination. No matter whatever, he used to think his hands are contaminated. To get rid of that thought, what he used to do is the hand washing, repeated hand washing. Initially, it was 7 to 8 times. Then it increased with the soap to 20 to 30 times. Then finally, he started using phenyl. And last time when I saw, he was not under treatment for longer time. Then the complete bones were exposed with the muscle atrophy.
Oh my gosh.
Yeah, but yes, there are different obsessions and compulsions like counting, doubting, abusing God, or this obsession about symmetry. So these are the different types of obsessions and compulsions.
So who develops OCD? Who's affected by it?
Anyone can develop OCD, but normally what we see this disorder in the age group of 20 to 35 years, males and females are commonly equally affected, and the prevalence is almost 2% among general population. If I have a first degree relative like mother, father or sister in the family who has got OCD, I have got certainly high chances to develop it. Post-streptococcal sore infection, that is one cause that person can develop. Head injury patients are more prone, and certain personalities like anxious avoidant personality, depressed personality, they tend to develop more commonly this disorder.
So can you cure OCD or how would you treat it?
Unfortunately, we cannot cure OCD, but yes, we can keep it under control. We can manage it effectively so that person can lead a manageable life, a reasonably good life. Usually the multimodal approach is used. For example, we use drugs initially to bring the symptoms under control. These are the antidepressants which are used in treating this. Secondly, some behavioral techniques are used. For example, we use the mode of thought stopping. If the person is not able to stop that thought, what we ask that person to tie a rubber band to wrist, we just ask to pull it. So immediate distraction is there. And that distraction gets linked in the brain. So the obsessive thoughts become less and less as it goes further. We can also try exposure and response prevention. For example, if I have got the obsession of contamination, I'll just imagine my hand to be submerged in the mud, and I'm not allowed to wash my hands for half an hour to 1 hour period. Now what happens, the anxiety builds up and it comes down. So slowly the person is able to manage his anxiety well in the obsessive compulsive disorder. These are the few techniques. If these are not getting effective, we use ECT, we use psychosurgeries now to control the disorder.
So OCD doesn't just affect one person, it can easily affect the family. Do you have any tips for family members who have a loved one suffering from OCD?
Yeah. The family members should understand first the concept of OCD. Secondly, they should not blame the relative. It's the OCD and it's not the relative who is troubling them because of the obsessions and compulsions. Third thing, as long as possible, they can keep the environment stress-free. The anxiety level should be less. The fourth thing, they should praise even little effort of relative to resist the compulsion. That is what is required. Fifth thing, what we require is the empathic support of the caregivers and not the over-involvement, not the criticism, not the hostility, not the indifference from them. These are the few techniques. If they follow, they can effectively handle the OCD patient at home.
So I hope this gives you guys a little bit of an insight into OCD. We have a lot more coming up for you in the coming episodes, so don't forget to subscribe to our channel. I'll see you guys later.